So I'm 19 weeks pregnant now, and my obstetrician has told me I have a low-lying placenta, which is obviously frightening me. What does this mean, and is it dangerous?
Low-lying placentas is a relatively common condition whereby the placenta reaches close to or even overlies the internal cervical ostia. It is quite common in early pregnancy. Approximately 1 in 10 pregnancies at 12 weeks gestation will show a placenta that reaches down close to or even overlies the internal cervical ostia. It is different from placenta previa. Placenta previa is a term used where after 20 weeks gestation where the placenta is close to or overlies the internal cervical ostia, whereas low-lying placenta is before 20 weeks gestation. Often, as the uterus expands, the placenta will migrate upwards with the expansion of the uterus, and in addition, the blood flow to the top of the uterus tends to be better than the blood flow to the bottom half of the uterus, and so the placenta will often show some migration as it grows up towards the top of the uterus with better blood flow. Now, placenta previa is a condition after 20 weeks where the lower edge of the placenta is within 2 centimeters of the internal cervical ostia. It is graded into 4 grades. Grade 1 is where it's within 20 millimeters of the internal cervical ostia. Grade 2 is where it is less than 20 millimeters of the internal cervical ostia and even reaches the internal cervical ostia but doesn't overlap the internal cervical ostia. Grade 1 and Grade 2 are known as minor placenta previas. They are conditions whereby if there hasn't been bleeding in pregnancy and the woman is very keen to try a vaginal birth, it is generally considered acceptable to attempt a vaginal birth. Major placenta previas is where the placenta overlies the internal cervical ostia. Grade 3 is where it's overlying the internal cervical ostia, and Grade 4 is pretty much where the placenta is smack bang over the internal cervical ostia. Grade 3 and Grade 4 are major placenta previas, and a vaginal birth in those situations are impossible as the blood loss to the baby is life-threatening and even potentially to the mother. If we find on morphology scan that there is a degree of placenta previa, the recommendation is to avoid any sexual activity or any stimulation of the cervix. And then we get another scan, usually at about 32 to 34 weeks, to see if the placenta has migrated. In 3/4 of these cases, the placenta has migrated. So at about 20 weeks, approximately 2% of placentas will be a placenta previa. However, by 34 weeks, this drops down to 1 in 200. If after 34 weeks, there is still a degree of placenta previa, once again, if it is grade 1 or 2, but the woman is very keen for a vaginal birth and there hasn't been bleeding in pregnancy, it is generally accepted okay to attempt a vaginal birth. However, if it is a major placenta previa and it is overlying the cervix, then a cesarean section is necessary. The timing of the cesarean section will depend partially upon how the pregnancy has gone. If there's been bleeding in pregnancy, especially repeated bleeding in pregnancy, the cesarean will be performed at an early gestation, even as early as 36 to 37 weeks. If things have been stable and there's been minimal or no bleeding, then the cesarean section can be pushed out to 37 to 38 weeks. Things that predispose to a low-lying placenta or placenta previa are increased maternal age, a previous history of placenta previa, scarring in the lower uterus, especially cesarean sections. The more one has a cesarean section, the greater increased chance of there being a placenta previa, with the placenta essentially being stuck to the previous cesarean section scars. Other factors are maternal smoking, IVF pregnancies, male fetuses for reasons that are unknown, or maternal use of cocaine or amphetamines. Pregnancies with a low-lying placenta, let alone a placenta previa, are at increased risk of antepartum hemorrhages or bleeding in pregnancies, often just with the uterus expanding or there being contractions to the lower end of the uterus, which is partly why the recommendation is to avoid sexual activity or even orgasm in pregnancy, as that can cause contractions of the lower uterus. But also heavy lifting, anything above 8 kilograms, or being on your feet for more than 4 hours at a time. Also, any vigorous activities such as horse riding or potentially even bike riding should be avoided. Later on in pregnancy, if there is placenta previa, let alone major placenta previa, and there's been bleeding in pregnancy, usually the woman will be admitted to hospital for observation for at least a few days. If it is major placenta previa and there's been recurrent major bleeding, then it is not uncommon for the woman to be admitted for quite a prolonged time, and the cesarean section will be scheduled earlier than usually intended, usually at about 36 weeks gestation. The important thing though is not to panic. If you have placenta previa, just follow your doctor's and midwife's advice, avoid any pressure or activity on the lower uterus, and get a further scan when you're between 32 and 34 weeks pregnant. Most of the time the placenta will move away, and even if it don't, the vast majority of women go on to have a safe cesarean section at around 37 to 38 weeks gestation.
So I'm 19 weeks pregnant now, and my obstetrician has told me I have a low-lying placenta, which is obviously frightening me. What does this mean? So I'm